So what is pain? Pain begins when nerve cells called nociceptors sense danger and send a signal up the spinal cord. This is signal pain. However, with MS, the process of demyelination causes an abnormal creation of nerve pain impulses. And so there are signals being sent when there isn't any danger. Not everybody experiences this with MS, and not everybody that experiences this all the time. But this is something that can happen with MS. So this abnormal creation of nerve impulses can result in a signal for pain when there is nothing there, when there isn't anything really causing the pain. Or it can amplify a very mild sensation. A touching can feel very painful, or a gentle warmth can feel like stabbing pain, or the feeling of burning. Burning in feet is a very common MS symptom, or something that feels like shocks. And this doesn't have to be constant. People can be holding a coffee cup and it could feel very comfortable and very normal, and all of a sudden it feels like the hand is burning. And the coffee cup, of course, has to be dropped. So, what are some causes of pain? Well, there's nociceptive pain, which is caused by tissue damage or inflammation. And we'll be talking more about inflammation later on. There's neurogenic or nerve pain, and that's what we're talking about often with MS, which is caused by damage to or dysfunction in the central nervous system or to a peripheral nerve. And this can have the feeling of shocking or burning or shooting pain. There is musculoskeletal pain, which can result from sprains, strains, pulls, muscle overuse, and this happens when people may be compensating for a lack of balance, or one leg that doesn't work as well as the other, or walking with mobility aids and not using them in the best way, and this overuse can cause this pain. And then spasticity caused by spinal cord damage can result in cramping, stiffness, and spasms. Well, what about pain in MS? Well, the MS Society has this to say about pain in MS, that most MS-related pain can be treated. And it's important to remember that not all pain that a person living with MS has is due to MS. So that is why it's so important to consult with your physician if you're experiencing pain, because assuming it's part of MS does not help you with managing the pain. And there could be something else going on, or something that could help you. Many factors contribute to pain, including emotional factors such as fear and worry. And of course, an evaluation by a qualified medical professional to pinpoint the source of pain is really essential, so you can really understand exactly what's going on with your pain. So what about inflammation? Inflammation is a contributing factor to pain. The main purpose of inflammation is to protect the body. And the process starts with pro-inflammatory hormones calling out for white blood cells to clean up damaged tissues and clear out infection. This creates a massive buildup of immune system armies. And with autoimmune disorders, even when the threat has passed or there is no threat, these inflammation armies can continue to build. Inflammation is a way to get the immune system to attack and surround anything that the body deems to be harmful. But of course, with autoimmune disorders, there can be a mistake about what's harmful and what's not harmful. More about inflammation. Inflammation is like a burner on your gas stove. The flame of a burning fire can help us cook or keep warm, but it can also hurt if we get our hand too close to it. So inflammation can continue on, and chronic inflammation can be very uncomfortable. Unregulated stress can lead to systemic or chronic inflammation, as can certain autoimmune difficulties. And certain foods are known to increase or decrease inflammation. There is information about this in your references. Dr. Mark Schoen has done quite a bit of research on inflammation, and his information is available in your resources and references.